Dear Deputy Minister, dear directors, colleagues and friends, welcome to Oslo and to the Norwegian Institute of Public Health, and welcome to the IANPHI Europe Annual Meeting. A little bit of housekeeping first. First of all, I'm Guri Rødtveit, the Director General of the Norwegian Institute of Public Health. And if an emergency should come up, we'll exit through the doors up on the top, and there should also be a door out over here at the floor. Toilets are up the stairs and to the left, and lunch will be served in the cantina just outside the auditorium. And should you have any questions, the Secretariat will be happy to answer any questions you may have. This may be the most important meeting for the IANPHI Europe Regional Network to date. The world as we knew it is no more, and the world order is changing rapidly. We are recovering from the COVID pandemic and implementing new measures and preparations, but we are still vulnerable to new health crises. Climate change is increasingly impacting on health in Europe and across the world. War and conflict in Ukraine, Gaza, Sudan, and many other places are killing and injuring hundreds of thousands of people. As a consequence, country budgets are reallocated away from health and to the military and defense. Human rights and international law are increasingly being violated, and international collaboration is at stake. Even our closest allies participate in this negative trend. Science-based knowledge in public health is being threatened and ridiculed through disinformation campaigns, even by world leaders. What is happening to our sister institute, the US CDC, is highly worrisome. The world health situation seems gloomy. Still, we, the European and Canadian public health institutes, cannot afford becoming disillusioned. Instead, we need to come together and act, and that is why this meeting is so important. Public health institutes in Europe and Canada and our collaborating partners in public health, we need to come together, collaborate closer, and do even more. We need to take on greater responsibilities for the global common good, which is also beneficial for each and one of us. So, let us strengthen our efforts to become a robust and visionary voice, especially now that the world is in dire need of hope. Thank you. And now we will have several distinguished leaders give their welcome remarks. And one of them is Dr. Usman Mushtaq, who is not only a politician, but also a highly skilled medical doctor in the area of public health. He has also accepted to give a keynote speech on the global public health situation. So that's the reason why we will have a keynote speech and a welcome remark from our Deputy Minister already now. So welcome, Usman.
Dear friends, can you hear me? Good morning to you all, and it's a great honor to wish you welcome to Norway and to this meeting. I'm so happy that our Public Health Institute is the organizer behind IANPHI's European Annual Meeting, and I would like to express my sincere gratitude for the fact that you're here and for your continued cooperation and for your work all across the network. I mean, we heard, and obviously, as you're probably noticing in your day-to-day life and work, how important it is that we are staying connected and at the fact that we're also collaborating about so many different issues. Public health and health in general is interconnected. Even though we have a lot of political discussions in many of our countries, which is leading us to more and more policies towards isolationism, we cannot fend off the rest of the world, particularly when it comes to health. We are in this together. And also in a Europe which is increasingly facing conflict and war, climate change-related emergencies, infectious disease outbreaks, pandemics, etc., and a flood of disinformation, which is eroding the basic trust between the public and the healthcare sector. The need for sanity, solidarity, and security is more needed than ever. And also the public health institutes are, I believe, uniquely positioned to provide trustworthy scientific leadership and practical response to some of these challenges. And I'm going to qualify this statement by saying and also showing towards what's going on in many countries outside of the of Europe, where you're seeing public health leaders stepping up and taking roles that are so important for them in their time of need, particularly what's going on in the US. Also across Europe, the collaboration between the public health institutes are more close than ever, and it is also needed for us to safeguard public health under these unprecedented pressures. Your meeting this year is anchored in analyzing these challenges and defining how we can collaborate to build resilience, to support solidarity and defend public health security for all people. In Norway, our public health policy, as set by the recent white paper that we announced, is firmly committed in reducing social health inequalities, promoting sustainability, and fostering international partnership. Now, all of these points are challenged in the political discourse that we have in our country. I mean, we just went through a election just a few weeks ago, where the defining theme of the election was how do you reduce taxes for the richest 1% of the population. Not the fact that we just came through a pandemic and our population is more ill, and that we need even more greater trust in the health interventions that is so important to get back on track. Also building trust within our society. So all of these points, we believe, require political capital, and they require the fact that us as a government are able to prioritize these issues, not only rhetorically, but also with money. Equitable access to healthcare services and addressing the underlying determinants of health also underpin a resilient and sustainable welfare society, also in line with our international commitments like the SDGs. And public health is just not a national matter. It is global in its reach and implications. One thing that we learned during the pandemic is that we are very dependent on how other public healthcare systems are set up across the world. As you know, infectious disease and emergence of pandemics and particularly pandemic-prone pathogens, these are reliant on, the weakest link, basically. So if you have, one weak link in the global chain of primary healthcare systems and public healthcare systems, then you are vulnerable. That is something that we take very seriously. Our three main national public health objectives are that Norway should be among the top 3 countries in the world for life expectancy. Number 2, that more years of good health and well-being for all with reduced social inequality. And 3, a society that actively promotes health for the whole of population. We believe that these goals are achievable, also because we invest significant amount of money into healthcare services. In today's climate of misinformation and fiscal pressure, science-based guidance from independent public health institutes are more important than ever. Our adherence to the highest ethical standards and scientific independence is fundamental to public trust. Norway could have not combated the pandemic the way that we did unless we had the trust in the public that we had. We could have not had the high level of acceptance of the vaccination programs, including the child vaccination programs, unless we had the trust from the public. And there, the Public Health Institute has played a tremendous role. The pandemic also highlighted the critical importance of coordinated international action, robust data sharing, and evidence-informed policymaking, all core mandates for modern public health institutes and all core mandates that are under pressure today. Preparedness against infectious disease, fostering vaccine confidence, and fighting AMR require enduring cross-border solidarity and regular transparent communication. Just recently, I was in a meeting with European health ministers a few weeks back where AMR was on the agenda. And there, one of our core points was that yes, in the Nordic countries, we're collaborating quite well because we have the same disease patterns related to resistant microbes. However, the situation is different in other parts of Europe. While I was listening to all the European health ministers, they were saying all the right things, but the indicators are pointing towards the wrong direction. And that also affects us here. It's national policy for us. So for us to be able to collaborate and cooperate on policies related to these, I would call global goods, is absolutely a key for our own national health security. So this is how we see as politicians how our health systems are interlinked with health systems across this continent and beyond. Our institutes must drive innovative research, maintain trusted surveillance, and speak up for the right to health for all, something that is especially important during periods of crisis and misinformation. As I mentioned, combating antimicrobial resistance is one of the flagship areas for international collaboration, and Norway has a new AMR strategy which acknowledges the crucial importance of the One Health approach, multi-sectoral action, national and international measures, and importantly, that all of these should be underpinned by research of the highest standards. Now, when I was listening to my colleagues from other parts of Europe, I was also listening that they had similar AMR policies. However, we need to convert the words into action, and that requires some political sacrifices, particularly, for instance, the way that we deal with antibiotics in the way that we grow and produce our food. Vaccination strategies, especially for emerging threats and for vulnerable groups, demand solid public trust, continuous evidence-based guidance, and system readiness, which no country can secure in isolation. Again, these are the core beliefs that we have, that we cannot stand isolated. We need more global cooperation. Norway's forthcoming adult immunization program will build on this principle, and we look forward to joint learning and alignment with European partners. We're very proud of the adult immunization program, which came in the wake of the pandemic, which we believe also will make us better prepared for the next health crisis. Other important fields such as climate adaptation, non-communicable disease and their common risk factors, pandemic response, and digital health equity also depend on strong public health alliance and shared accountability. Recently, we introduced a law that banned marketing of unhealthy foods for children under the age of 18. Obviously, we're meeting a lot of resistance here on that from the industry, but that is one point where also we are increasingly looking towards our European partners and seeing if we could make these measures in tandem with other European countries so we can also build better trust. We must ensure systematic, transparent evaluation of all public health actions and strengthen our research and surveillance infrastructure, including local, regional, and global data systems and sharing. With the dismantling of US aid and the concerted attack on CDC's independence, we believe that particularly focusing on regional and global data systems are much more important. In the Norwegian experience, public trust in institutions, recommendations, and leadership has been essential for effective pandemic response and long-term investments in public health. This trust must be deliberately maintained. Trust is something that we borrow, not that we get. Across borders, languages, and social divides, by embedding inclusion, respectful dialogue, and respect for all communities in our work as main drivers for the public health institutes. Now, in these uncertain times, the National Public Health Institutes in Europe must be the advocates for solidarity, equity, and science, even though that you are called by some political leaders as naive. You must stand against this notion. Together, you can work for a more inclusive and resilient and healthy European region with a strong global voice. Now, we also have to remember that in this time where governments are cutting spending, particularly for international health programs, this is not a static situation. Things are going to change. And if it's going to change, we also require leaders that are willing to speak up for the benefits of international cooperation. Norway reaffirms our commitment to continued collaboration and collective responsibility for the public health, both within Europe and beyond. So let's use this meeting to strengthen our shared vision, learn from each other, and build each other up so we can renew our resolve. Thank you so much.
Encouraging message, which I'm sure this audience really takes well. We need that. We need that kind of messages from the political standpoint these days. I think there should be something that we should give to the. Okay, it's very well hidden. And I'm sure you've had something like this before, but you will have one at least. Thank you again. Our next speaker is Antonis Lanaras, who will speak on behalf of Pamela Rendi-Wagner, who is the Director General of the ECDC, as you all know, but who has become ill and couldn't make it to this conference. So Antonis Lanaras is the Head of Section Governance and International Relations at ECDC. Okay. And welcome. We look forward to hearing what you have to say, Antonis.
Thank you. Good morning, colleagues. Dear Deputy Minister, dear Director General, dear Chair of the IANPHI Europe Network, dear directors, dear colleagues. I'm very pleased to be here today and say a few words on behalf of my director, ECDC Director, Dr. Pamela Rendi-Wagner, who unfortunately was unable to attend, but her thinking is with you. So I will say a few words on her behalf. She considers this meeting very important, and because we feel part of this group, and we hope that the next time she will be able to address you herself directly. And I would like to start by underlining the added value for public health of the cooperation between IANPHI and ECDC, in particular in these challenging times. To mention that we have a long-standing collaboration between our two organizations, a partnership that is beneficial to the institutions and the member states, as well as the national public health institutes that are present here today, that we both serve and support. And I would like to praise the work of IANPHI to enhance the capacity of national public health institutes and to foster collaboration and knowledge sharing among the institutes. ECDC collaborates with all of you, either as members of the ECDC governing bodies, the management board, the advisory forum, as directors and national coordinators of the coordinating competent bodies in the EU member states and EA countries, and ECDC national correspondents in the enlargement countries. But I would like to stress the importance of IANPHI in promoting public health, but also the uniqueness of IANPHI meetings and works in these informal discussions, so that we feel comfortable to talk about the challenges and the needs that all of us are facing. And I would like to thank you for considering ECDC as part of the IANPHI family, and that you always invite us to be with you in your meetings, but also in your activities, although we're not a member of IANPHI. But recently we made a big step forward. The relationship between the two organizations was formalized with the signature of a memorandum of understanding in April this year at the annual meeting of IANPHI in Maputo, Mozambique. And this MOU covers key public health areas for future collaboration between the two organizations, including preparedness, surveillance, training and capacity building, sustainable development goals for communicable diseases, and the impact of climate change on communicable diseases. Areas that reflect ECDC's strategic priorities for the next period. Strategic priorities that have been discussed with our governing bodies during the past months and will be submitted for endorsement by the management board in its session in November as part of the single programming document for 2027. These priorities aim to take the implementation of the new mandate of ECDC amended in 2022 to the next stage and to effectively support our member states by fostering implementation of One Health approach, including addressing antimicrobial resistance and strengthening health resilience against climate change. Second, strengthen immunization and prevention programs and resource investments in prevention infrastructures and services. Third, strengthen early warning, emergency preparedness and response activities in the EU member states, EEA countries, and at the EU level. Fourth, promote digitalization, integration, and standardization of surveillance and laboratory capacity for effective disease prevention and control. And finally, strengthen strategic partnerships at the EU and international levels to intensify synergies and avoid duplication of actions in response to the call we received from the new mandate, but also from the serious cross-border threats regulations. The new status of ECDC as IANPHI observer partner opens new avenues for collaboration between our organizations through exchange of expertise related to infectious diseases towards health security preparedness at EU level and globally. Looking forward to deepening this collaboration and to the discussions today and tomorrow. Thank you very much.
Thank you so much for those words. You're definitely a part of the IANPHI family, and we're happy to have you here and also in the future. Now I know where the chocolate is, so just a minute. So thank you so much for your
Thank you very
words.
much. Thank you. Thank you indeed. Thank you. Thank you.
So the next speaker we will have on a video. There will be a video message, and that is Dr. Hans-Henry Kluge, Regional Director from the WHO Regional Office for Europe. And I now leave the technicalities to you.
Dear Professor Duncan Selby, Professor Neil Squires, ladies and gentlemen, colleagues and friends, I stand before you with a deep sense of solidarity and admiration. As public health professionals, I know many of us have faced sudden funding cuts and attacks, added to the chronic disinvestment, workforce shortages, and burnout after the COVID-19 pandemic. Yet you have used your voice and stood in solidarity with WHO and global public health institutions. And for that, I'd like to thank you and thank you. Let me be candid. I have walked this path for years, many of you know, from the field to the global stage. And I know why public health matters. In 2024, together, we analyzed over 300,000 signals and pieces of information to detect, verify, assess risk and respond to acute public health threats before they escalate. This is not something abstract. This means lives saved, economies strengthened. But we must also recognize our shortcomings. At times, we have been resistant to change, reflecting the difficulty of shifting well-established systems. Our public health workforce is aging. Morale is suboptimal, and we have not yet succeeded in attracting the next generations at the scale required. Now, looking forward, I invite you to imagine a European region where health is safeguarded as a universal commitment. Never politicized, always prioritized. This vision, anchored in the second European Programme of Work, rests on the capacity of our public health institutions to put communities at heart, foster collaboration, and unleash innovation. For this vision to become reality, we need the guiding hand of strong public health leadership and leaders. We need to concentrate on developing the next generation of public health leaders, and I would envisage IANPHI and the WHO Regional Office working together on this more proactive and scaled up. That's why I call on each of you to continue to work united, the guardians of health and well-being that you are, based on the values of equity and solidarity, leaving no one behind. As of myself, I commit to continue being a fierce advocate and defender for you and for public health, guided by evidence and science, not ideology, not politics. These are challenging times in public health, but I have seen the achievements of Europe's public health community. I have seen that community's competence, stamina and courage, and that's why I know we both can and will meet these challenging times heads on. Let us move forward together, better together. Thank you.
Thanks to Dr. Kluge for those encouraging remarks. And then we will move on to Professor Duncan Selby, who is the IANPHI president. He will also be on delivering a video message.
Good morning, everyone. Duncan here. I want to say a warm welcome to everyone for this important European conference. Particular thank you to Dr. Guri from the Norwegian Institute of Public Health for hosting the meeting, and Bjorn, who are always very appreciative, Bjorn, to Sarah from the Secretariat team and everybody involved in making this event happen and putting together the excellent programme. The themes of sanity, solidarity and security could not be more important or matter more at this time. With all the changes going on in the global architecture, the funding reductions, the uncertainties that exist in lots of the global institutions, these are the moments when we have to bring together ourselves and all those that we work with and represent, and provide that sane, sensible and rational argument about why it matters so much to be concerned with the public's health. Solidarity, because we are stronger together. I know that can sound a bit cheesy, but we know it's true. And security, because we have to learn from each other and we need to share data and knowledge together. And through this, we can extend and strengthen security in the world. So these three themes are hugely important, and of course they're interdependent. And the discussions over the course of the conference further the contribution that Europe is already making to global health in Europe, but also more impactful globally. And I want to continue to see that getting stronger and strengthening, and the European contribution to global health and IANPHI and its striving and its work to keep all these matters on the top of the agenda in Geneva and with national governments so important. I want to thank as well the Robert Koch Institute, which first time hosting IANPHI, and this is the first big event since the hosting decision transferred from our colleagues in France. And again, to for making these times we have together so productive and important in building our relationships and our friendships together. So thank you from me. I wish I could be with you, but the travel arrangements from Saudi Arabia and other commitments mean that I can't be, but I am with you in spirit, and I'm very much behind the discussions that you'll be having. Thank you.
Thank you very much to our presidents of IANPHI. And now we will move on to people who are physically here. And that is Claudia Habel, who is the chair of IANPHI Europe Network. And she's also one of the directors of the Austrian Public Health Institute. Welcome, Claudia.
Thank you so much. Remember to keep it close to your mouth.
Thank you. I hope you all can hear me well. Olga, will you step up? You come later. I'm so happy to be here together with my dear friend and co-chair, Olga Kudevska from the Ukrainian Public Health Institute. I think you can stand with me. We prepare things in late minute, but that is how we are all working, I think, nowadays. So I will want to show you what happened since the last, I hope you can read that. It's a bit much. What happened since the last meeting in Budva in Montenegro. A major change was that our previous chair, Trygve Ottersen from Norway, he had to step down because he changed his position. And consequently, I was elected in last February to be the next chair, and Olga, she still stayed with me. You say something, please.
Good morning, firstly, all colleagues. Glad to be here, and actually, since Trygve leave us, I was acting for a chair. And here I would like to thank to Norwegian Institute, to Trygve and to Bjorn for your dedicated work to IANPHI, apart with your work. Thank you. And we are really glad that we were able to conduct this annual meeting here in Oslo. Thank you for hosting this meeting here. And thank you for overall your contribution.
Well, I will report a bit what we did since the last meeting. We had a couple of webinars, especially if you remember, it was something also Trygve started with Björn and others. We made a survey starting already in 2023 on the use and uptake of AI in the public health institutions. Actually, it was my first concrete work. Austria is not member for so long time, but still since I think we applied in 2019. But this was also a very pressing issue for us. So we took over this work then from the Norwegian Institute and finalized it, did the analysis. And we had two sessions on the European Public Health Conference in Portugal last year, one as a pre-conference devoted with some UFA sections like the one on digital health, and then an extra one where also Knut Inge, I think some of you know him, he's the coordinator of the biggest joint action ever on Prevent NCD here from Norway. He and I had a session and we looked at different angles for public health, and I had the job to look at the AI part. I'm honest, I think if we repeat this now, not so many of you contributed at that time, only 15 institutions. I think it's now a topic for everyone, and this will be one of the topics to be discussed how we continue for here.
We also had, of course, the annual meeting in Maputo. 7 European countries were represented there. We had a webinar, Shaping European Health Policies, Strengthening the NPH Roles in Transnational Challenge, where we talked about the current EU for Health program and what are the opportunities for collaboration. We had some contributions, of course, to the thematic committees, especially the one on climate change and the one on social and public health inequalities. We were invited to speak in the European Health Forum Gastein on the topic of global health diplomacy. And there's an upcoming webinar. The title is still the working title on ethical perceptions and concerns of public health professionals. And Catherine of Santé Publique will be organizing it still this year, she promised. And then, will you continue with the activity?
Yes, thank you. We finalized our activity plan in April, in late April. Still there is clear guidelines for coming year, and we are on good track, except recruiting of new partners. So it's membership association, so feel free to join this activity and to invite probably your neighborhood countries to our network, to our community. I believe they benefit from that. As well, we continue to work on partnerships. We have a quite close collaboration with EuroHealthNet. Caroline is here as well, and with all other institutes, HADEA, ECDC, ASFER, so on. And still we explore cooperation with WHO Pan-European Network on disease. We invite them for the conference. Unfortunately, the participation was not confirmed, if I'm not mistaken, so far. And the last but not the least, during 2 days, and actually tomorrow we'll have, and I am really very expected great results from the session number 5, when we will present analysis of the National Health Institute's capacities. And I believe it's international survey, which we started 2 years ago, and work quite hard during this year to finalize the findings. And I believe it's a place where all of us can learn more about your counterparts in other countries, set more close collaboration with other countries, explore and learn much more from that. So it's like teaser for the session number 5. Stay with us till session number 5, and I believe that you will enjoy this as well.
And then we wanted to also discuss with you the thematic focus we have. So one topic we have always ongoing is the scientific independence. So how can we ensure best our scientific independence? Limitations on political influence or influence from private sector operators, commercial industry. We talk about the commercial determinants of health nowadays. I think in IANPHI it's very important that we really try to be independent, and also for us as public health institutions. I think most of you will know what I'm talking about. It was mentioned that all of us are faced with budgetary cuts, everyone. And so, of course, we need to be carefully balance our resources. Then the climate change,
Climate change, we continue work at subcommittee, and upcoming Lion meeting in cooperation with French Development Agency will occur this
November, I think.
Yeah, late November. And next is artificial intelligence. Already Claudia touched a little bit, but please.
Yeah, no, we have, I think also to discuss, there was plans for a small working group of willing countries, and some countries I could, when I took over from Trygve, secure a couple of countries, including Norway, to contribute a bit, but not somebody to lead. You know, I have Belgium, we have the Dutch who are interested, France is interested, Austria is interested, Finland. It's a pity Mika is not here because I wanted to convince him to be this group leader. Actually, and I know that RKI, this is a difference to the survey we made, I think invested really millions, perhaps Angela can tell us about it, in some eastern part of Germany. In some colleague told me 60 staff working on AI alone and more to be hired. So perhaps we can help have helped there. And what else we will do is the positive impact on the HPIs and European health policy and legislation. I think we need to all together strengthen our coordinating advocacy efforts. As I mentioned, there was this health diplomacy activity in Gastein last week, and there was a big debate about if it's diplomacy or advocacy and what's the difference, but it's wording. I think we need to stand strong together and work for public health and funds for that.
Yeah, and still we should continue to be independent. Today, the Deputy Minister addressed this issue, and all other speakers on the welcome session address as well. So we should like balance between independence and diplomacy, and still. Unfortunately, health still continue to be a political issue. Even if we would like to be independent, but still we should keep in mind then. So
I can down to the next part, because finally we want to voice our expectations, or we call it then hopes for this meeting. And I think the hopes are high for a number of reasons. This was too quick. I'll come to that. We think we all have a hybrid war with Russia, and some of us, unfortunately, have an actual war. We have a gap in demographics. When it comes, we have less contributors, money-wise, and less contributors for the health workforce that was mentioned. We have more consumers, and we need more resources. We are faced with growing nationalism, liberalism, threatening our solidarity system. We experience a shift in the global governance, don't we? We have new tech giants influencing politics. We have the end of the rules-based order, perhaps. And finally, we are in the middle of a climate crisis. So I think the hopes are even low that we have here. We need to foster exchange and collaboration. I always say the corridor talks are as important as all the sessions we have. And I really expect concrete, tangible actions. We need follow-up on the results, and that's why thanks for those who will comment on the results that my dear colleague Kati will present on the session 5 tomorrow, on how to carry on, what to do with these results. We need a stop-or-go decision, I think, on the work on AI. Is this group taking place, shaping? Then we need a lead. We need resources, let's be honest, to coordinate such a things, we need at least a half full-time equivalent. So who is willing to do that? Because the Secretariat will support, I think, with organizing webinars or giving us a room for that. But the actual, ongoing work has to be done by ourselves. And we have to, of course, give input for the work plan for ECDC that was mentioned today. We should think of, do we create such an European public health consulting group I mentioned? It's also, of course, a coalition of the willing. If we want to have our own public health program, I think we have to fight for it, and also funds from the EU for that. And of course, we need more webinars if we want to learn from each other, as we say.
But for webinars, we as well need the request. So feel free to request what theme will be more important for your institution. So we will explore and learn the possibilities to organize and to invite the best speakers to the webinars and to be as much useful as possible for you. We still jointly plan to have up to 4 webinars per year. So feel free to reach us, to reach ladies from the Secretariat with a request or with ideas. And we will be happy to be useful in this direction.
And there's a lot of female power in this room, which I like. We are on directors and general directors level. So I expect that you will do what women do to run the show, okay?
Claudia, will you come back? Thank you so much, both of you, for challenging us in front of these 2 days. I'm also very sorry that I didn't introduce you, Olga, because I thought you were doing it in separate sessions. But thank you so much for being here. I want to say that in particular because we know you're coming from a country that is in a very, very difficult situation. So we're glad to have you here. Thank you. And now you will also have some Norwegian chocolates. big supply. Yeah, there is. You can tell. Okay. Thank you very much, both of you, for your efforts. And now the final speaker in this opening session will be our Neil Squires, who is the IANPHI Secretary General. Quite new in that position, but not new at all in this field. So we welcome you, and we're eager to hear what you have to say.
Just check this is working. Yeah. Wasn't that fantastic? That is IANPHI in action. Sort of, Claudia and Olga together, yeah, speaking as one, really is a demonstration of the power of NPHIs working together. And really that's what we're trying to achieve. I mean, if we can amplify and replicate that globally, that is the primary objective of IANPHI. IANPHI started in 2006 as a network to connect the leaders of national public health institutions. And that phone a friend function is critically important. But it's expanded beyond that to become a connection between institutions, the peer-to-peer support, which is critical if we want to be a global community promoting public health. So I was really impressed to see that teamwork, and hopefully that is something that we can build on during these 2 days, but also extend into the wider global network of IANPHI. That's critically important. Huge thanks, Minister, for those words. It's rare to see such harmony between the political leadership and the technical advice, and that is so inspiring. And I wish the world had that type of political leadership in terms of shaping it, and we would be in a much sort of safer and saner world if we had every country had that type of political leadership. I think it's critically important. The themes of this conference, I mean, it's worthwhile looking at the counterfactual. The opposite of sanity is madness, and to some extent we see degrees of madness in the current way in which changes are rapidly being made, the destruction and the chaos that potentially causes, and encouraging and developing sanity through connection is incredibly important. The opposite of solidarity is fragmentation, and we are seeing the risk of increasing fragmentation in different programs. So bringing people together, joining them, uniting them is what we're about. And I think we have a network that is like-minded and can do things together. And we can see the opposite of security, the wars, the conflict, which are troubling and impacting on so many people that we must collectively strive to combat. So the themes of this conference, Bjorn, thanks to you, your brainchild, is absolutely right to highlight these issues, and I think it makes for such a rich discussion. We've also heard, from some colleagues in WHO, and it's great to have colleagues here from WHO today. That partnership is critically important. A critical global institution under attack to some extent, and made weakened potentially, but hopefully emerging stronger, a phoenix from the ashes maybe, through the support that we can all collectively provide in order to fill in the gaps that have been created by the cuts in funding. So again, together, collectively, we can support WHO. The world needs a strong World Health Organization, and the message from Hans Kluge was critically important. So I think we have all of the ingredients here for an excellent 2-day meeting. IANPHI is in the process of renewing its strategy. So our last strategy finishes at the end of this year. So I also hope in the margins and through the discussions to inform that process. We'll have another dialogue at the World Health Summit and a range of other consultations. But our current emphasis is on strengthening professional linkages. That remains absolutely key. Harnessing our collective experience. I mean, the talent and the scientific knowledge and the expertise rests within the public health institutions in this room and in the wider IANPHI network, and we need to mobilize that to promote public health. Engaging and supporting and growing that membership. Already, some of these corridor conversations, Antonis mentioned some of the other EU member states who aren't members. So Greece, we need to reach out and bring more people into this family for collective action. So that remains a priority. And advocating globally, critically important. So I think we're going to have a fantastic couple of days and time now to sort of get on with the rest of the program. But thank you all so much for being here.
Thank you, Anil. Just you know what awaits you. Thank you so much for your kind words and for your challenging and encouraging remarks. It's very important to take that into the next 2 days. And
Thank you.
And by that we have had. We are now going to have, thank you, Björn. I was going to say that we are finalizing this opening session, which we are. Thank you to all the presenters for challenging and encouraging remarks.